Hello everyone, I am Ana Marie Pacheco, and in this video I will be discussing about Attention Deficit Disorder or ADD, also known as Attention Deficit Hyperactivity Disorder or ADHD. So I am hoping that after watching this video you will be able to define what is ADHD, learn the symptoms, the causes of this particular disorder, the treatments that are provided, and also how it is being diagnosed, as well as what are the efforts that are being done by the National Institute of Mental Health in order to improve the treatment. So, okay, let me start the discussion. So, before we define ADHD, let us first compare the difference between ADD and ADHD. So, is ADD and ADHD the same thing? ADHD is sometimes referred to as ADD or Attention Deficit Disorder, but ADD is an older term. Up until 1987, when the word hyperactivity was added to the name, before that, say in 1980, a child would be diagnosed with ADD, with or without hyperactivity. So ADHD is the official medical term for the condition, regardless of whether a patient demonstrates symptoms of hyperactivity. ADD is a now outdated term that is typically used to describe inattentive type ADHD. So in 1994, doctors decided all forms of ADD would be called ADHD even if the person is not hyperactive. Okay, so what is Attention Deficit Hyperactivity Disorder? Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common childhood disorders and can continue through adolescence and adulthood. Symptoms include difficulty staying focused and paying attention, difficulty controlling behavior, and hyperactivity or overactivity. So ADHD has three subtypes. First is the predominantly hyperactive impulsive, where most symptoms are in the hyperactivity impulsivity categories. Fewer than 6 symptoms of inattention are present, although inattention may still be present to some degree. The second one is predominantly inattentive. So here, the majority of symptoms are in the inattention category, and fewer than 6 symptoms of hyperactivity impulsivity are present, although hyperactivity impulsivity may still be present to some degree. So in this subtype, children are less likely to act out or have difficulties getting along with other children. They may sit quietly, but they are not paying attention to what they are doing. Therefore, the child may be overlooked and parents and teachers may not notice that he or she has ADHD. The last subtype is combined hyperactive impulsive and inattentive. So here, 6 or more symptoms of inattention and 6 or more symptoms of hyperactivity impulsivity are present. Most children have the combined type of ADHD. So treatments can relieve many of the disorder's symptoms, but there is no cure. With treatment, most people with ADHD can be successful in school and lead productive lives. Researchers are developing more effective treatments and interventions and using new tools such as brain imaging to better understand ADHD and to find more effective ways to treat and prevent it. So what are the symptoms of ADHD in children? Inattention, hyperactivity, and impulsivity are the key behaviors of ADHD. It is normal for all children to be inattentive, hyperactive, or impulsive sometimes. But for children with ADHD, these behaviors are more severe and occur more often. To be diagnosed with the disorder, a child must have symptoms for 6 or more months and to a degree that is greater than other children of the same age. Children who have symptoms of inattention may be easily distracted, miss details, forget things, and frequently switch from one activity to another, have difficulty focusing on one thing, become bored with a task after only a few minutes unless they are doing something enjoyable, have difficulty focusing attention on organizing and completing a task or learning something new, have trouble completing or turning in homework assignments, often losing things, such as pencils, toys, assignments, needed to complete tasks or activities, not seem to listen when spoken to, daydream, become easily confused and move slowly, have difficulty processing information as quickly and accurately as others, and struggle to follow instructions. Children who have symptoms of hyperactivity may fidget and squirm in their seats, talk nonstop, dash around touching or playing with anything and everything in sight, have trouble sitting still during dinner, school, and story time, be constantly in motion, have difficulty doing quiet tasks or activities. And children who have symptoms of impulsivity may be very impatient, blurt out inappropriate comments, show their emotions without restraint, and act without regard for consequences, have difficulty waiting for things they want or waiting their turns in games, and often interrupt conversations or others' activities. So, what causes ADHD? Scientists are not sure what causes ADHD, although many studies suggest that genes play a large role. Like many other illnesses, ADHD probably results from a combination of factors. In addition to genetics, researchers are looking at possible environmental factors and are studying how brain injuries, nutrition, and the social environment might contribute to ADHD. So, first is genes. Inherited from our parents, genes are the blueprints for who we are. Results from several international studies of twins show that ADHD often runs in families. Researchers are looking at several genes that may make people more likely to develop the disorder. Knowing the genes involved may one day help researchers prevent the disorder before symptoms develop. Learning about specific genes could also lead to better treatments. The second cause would be environmental factors. Studies suggest that a potential link between cigarette smoking and alcohol use during pregnancy and ADHD in children. In addition, preschoolers who are exposed to high levels of lead, which can sometimes be found in plumbing fixtures or paint in old buildings, may have a higher risk of developing ADHD. Brain injuries could also be a cause of this disorder. Children who have suffered a brain injury may show some behaviors similar to those of ADHD. However, only a small percentage of children with ADHD have suffered a traumatic brain injury. Another thing is the sugar consumption. So, sugar consumption may cause hyperactivity given that snacks contain high sugar contents that stimulates an increase in epinephrine, leading to activation of nervous reactions and hyperactivity disorder behaviors. Lastly is the food additives. Recent British research indicates a possible link between consumption of certain food additives like artificial colors or preservatives and an increase in activity. Research is underway to confirm the findings and to learn more about how food additives may affect hyperactivity. So, how is ADHD being diagnosed? So, children mature at different rates and have different personalities, temperaments, and energy levels. Most children get distracted, act impulsive, and struggle to concentrate at one time or another. Sometimes these normal factors may be mistaken for ADHD. ADHD symptoms usually appear early in life, often between the age of 3 and 6, and because symptoms vary from person to person, the disorder can be hard to diagnose. Parents may first notice that their child loses interest in things sooner than other children or seems constantly out of control. Often teachers Notice the symptoms first. When a child has trouble following rules or frequently spaces out in the classroom or in the playground. So there is no single test that can diagnose a child as having ADHD. Instead, a licensed health professional needs to gather information about the child and his or her behavior and environment. A family may want to first talk with the child's pediatrician. So some pediatricians can assess the child themselves, but many will refer the family to a mental health specialist with experience in childhood mental disorders such as ADHD. So the pediatrician or mental health specialist will first try to rule out other possibilities for the symptoms. For example, like certain situations, events, or health conditions may cause temporary behaviors in a child that seem like ADHD. So between them, the referring pediatrician and specialist will determine if a child is experiencing undetected seizures that could be associated with other medical conditions, has a middle ear infection that is causing hearing problems, has any undetected hearing or vision problems, has any medical problems that affect thinking and behavior, has any learning disabilities, has anxiety or depression or other psychiatric problems that might cause ADHD-like symptoms, has been affected by a significant and sudden change, such as the death of family member, a divorce, or parents' job loss. So a specialist will also check school and medical records for clues to see if the child's home or school settings appear unusually stressful or disrupted, and gather information from the child's parents and teachers. So coaches, babysitters, and other adults who know the child well also may be consulted. The specialist also will ask questions like, are the behaviors excessive and long-term, and though they affect all aspects of the child's life? Do they happen more often in this child compared with the child's peers? Are the behaviors a continuous problem or a response to a temporary situation? Do the behaviors occur in several settings or only in one place, such as the playground, classroom, or home? So the specialist pays close attention to the child's behavior during different situations. So some situations are highly structured while some have less structure. Others would require the child to keep paying attention, and most children with ADHD are better able to control their behaviors in situations where they are getting individual attention and when they are free to focus on enjoyable activities. So these types of situations are less important in the assessment. A child also may be evaluated to see how he or she acts in social situations and may be given tests of intellectual ability and academic achievement to see if he or she has a learning disability. Finally, if after gathering all this information, the child meets the criteria for ADHD, he or she will be diagnosed with the disorder. So how is ADHD treated? Currently available treatments focus on reducing the symptoms of ADHD and improving functioning. Treatments include medication, various types of psychotherapy, education or training, or a combination of treatments. So in medication, stimulant is the most common type of medication used for treating ADHD. So although it may seem unusual to treat ADHD with a medication considered a stimulant, it actually has a calming effect on children with ADHD. Many types of stimulant medications are available. A few other ADHD medications are non-stimulants and work differently than stimulants. For many children, ADHD medications reduce hyperactivity and impulsivity and improve their ability to focus, work, and learn. Medication also may improve physical coordination. However, A one-size-fits-all approach does not apply for all children with ADHD. What works for one child might not work for another. One child might have side effects with a certain medication, while another child may not. Sometimes several different medications or dosages must be tried before finding one that works for a particular child. Any child taking medications must be monitored closely and carefully by caregivers and doctors. So the stimulant medications come in different forms, such as pill, capsule, liquid, or skin patch. Parents and doctors should decide together which medication is best for the child and whether the child needs medication only for school hours or for evenings and weekends too. So what are the side effects of stimulant medications? The most commonly reported side effects are decreased appetite, sleep problems, anxiety, and irritability. Some children also report mild stomach aches or headaches. Most side effects are minor and disappear over time or if the dosage level is lowered. So decreased appetite. So in decreased appetite, the parents should make sure that their child eats healthy meals. If this side effect does not go away, the parent should talk to the doctor. Also talk to the doctor if you have concerns about the child's growth or weight gain while he or she is taking this medication. Next is sleep problems. If a child cannot fall asleep, the doctor may prescribe a lower dose of the medication or a shorter acting form. The doctor might also suggest giving the medications earlier in the day or stopping the afternoon or evening dose. And lastly are the less common side effects. So a few children develop sudden repetitive movements or sounds called tics. So these tics may or may not be noticeable. Changing the medication dosage may make tics go away. Some children also may have a personality change, such as appearing flat or without emotion. So, with these types of side effects, the parents should talk with their child's doctor if they see this kind of side effects. So, are stimulants medications safe? Under medical supervision, stimulant medications are considered safe. Stimulants do not make children with ADHD feel high, although some kids report feeling slightly different or funny. Although some parents worry that stimulant medications may lead to substance abuse or dependence, there is little evidence of this. So in 2007, the FDA required that all makers of ADHD medications develop patient medication guides that contain information about the risks associated with the medications. The guides must alert patients that the medications may lead to possible cardiovascular or psychiatric problems. The agency undertook this precaution when a review of data found that ADHD patients with existing heart conditions had a slightly higher risk of strokes, heart attacks, and or sudden death when taking the medications. So next is psychotherapy. Different types of psychotherapy are used for ADHD. Behavioral therapy aims to help a child change his or her behavior. It might involve practical assistance such as help organizing tasks or completing schoolwork or working through emotionally difficult events. Behavioral therapy also teaches a child how to monitor his or her own behavior. Learning to give oneself praise or rewards for acting in a desired way, such as controlling anger or thinking before acting, is another goal of behavioral therapy. Parents and teachers also can give positive or negative feedback for certain behaviors. In addition, clear rules, chore lists, and other structured routines can help a child control his or her behavior. Therapists may teach children social skills such as how to wait their turn, share toys, ask for help, or respond to teasing. Learning to read facial expressions and the tone of voice in others and how to respond appropriately can also be part of social skills training. So how can parents help with their children who are diagnosed with ADHD? So children with ADHD need guidance and understanding from their parents and teachers to reach their full potential and to succeed in school. Before a child is diagnosed, frustration, blame, and anger may have built up within a family. Parents and children may need special help to overcome bad feelings. Mental health professionals can educate parents about ADHD and how it impacts a family. They also will help the child and his or her parents develop new skills, attitudes, and ways of relating to each other. Parenting skills training helps parents learn how to use a system of rewards and consequences to change a child's behavior. Parents are taught to give immediate and positive feedback for behaviors they want to encourage and ignore or redirect behaviors they want to discourage. In some cases, the use of timeouts may be used when the child's behavior gets out of control. In a timeout, the child is removed from the upsetting situation and sits alone for a short time to calm down. Parents are also encouraged to share a pleasant or relaxing activity with the child, to notice and point out what the child does well, and to praise the child's strengths and abilities. They may also learn to structure situations in more positive ways. For example, they may restrict the number of playmates to one or two so that their child does not become overstimulated. Or if the child has trouble completing tasks, parents can help their child divide large tasks into smaller, more manageable steps. Also, parents may benefit from learning stress management techniques to increase their own ability to deal with frustrations so that they can respond calmly to their child's behavior. Next is what conditions can coexist with ADHD. So, some children with ADHD also have other illnesses or conditions. For example, they may have one or more of the following: a learning disability. So, a child in preschool with a learning disability may have difficulty understanding certain sounds or words, or have problems expressing himself or herself in words. A school-aged child may struggle with reading, spelling, writing, and math. Another thing is oppositional defiant disorder. So kids with this condition, in which a child is overly stubborn or rebellious, often argue with adults and refuse to obey rules. Next is conduct disorder. This condition includes behaviors in which the child may lie, steal, fight, or bully others. He or she may destroy property, break into homes, or carry or use weapons. These children or teens are also at a higher risk of using illegal substances. Kids with conduct disorder are at risk of getting into trouble at school or with the police. Another is anxiety and depression. Treating ADHD may help to decrease anxiety or some forms of depression. Next is bipolar disorder. Some children with ADHD may also have this condition, in which extreme mood swings go from mania, an extremely high, elevated mood, to depression in short periods of time. And lastly is Tourette syndrome. So very few children have this brain disorder, but among those who do, many also have ADHD. Some people with Tourette syndrome have nervous tics and repetitive mannerisms, such as eye blinks, facial twitches, or grimacing. Others clear their throats, snorts or sniff frequently, or bark out words inappropriately. So these behaviors can be controlled with medication. Aside from those conditions, ADHD also may coexist with a sleeping disorder, bedwetting, substance abuse, or other disorders or illnesses. So recognizing ADHD symptoms and seeking help early will lead to better outcomes for both affected children and their families. Okay, so next is what efforts are done to improve the treatment. So, this is an exciting time in ADHD research. The expansion of knowledge in genetics, brain imaging, and behavioral research is leading to a better understanding of the causes of the disorder, how to prevent it, and how to develop more effective treatments for all age groups. So, the NIMH, or the National Institute of Mental Health, has studied ADHD treatments for school-age children in a large-scale, long-term study called the Multimodal Treatment Study of Children with ADHD, or MTA study. So the NIMH also funded the Preschoolers with ADHD Treatment Study, or PATS, which involved more than 300 preschoolers who had been diagnosed with ADHD. So the study found that low doses of the stimulant methylphenidate are safe and effective for preschoolers, but the children are more sensitive to the side effects of the medication, including slower than average growth rates. Therefore, preschoolers should be closely monitored while taking ADHD medications. So PATS is also looking at the genes of the preschoolers to see if specific genes affected how the children responded to methylphenidate. So future results may help scientists link variations in genes to differences in how people respond to ADHD medications. So for now, the study provides valuable insights into ADHD. Other NIMH-sponsored clinical trials, however, on children and adults with ADHD are underway. In addition, NIMH-sponsored scientists continue to look for the biological basis of ADHD and how differences in genes and brain structure and function may combine with life experiences to produce the disorder. So that is the end of my discussion. I got the reference on a book, Attention Deficit Hyperactivity Disorder or ADHD PDF booklet by the National Institute of Mental Health, U.S. Department of Health and Human Services. So that is all. Thank you for listening, everyone. I hope you learned something from my discussion.